Hello and good afternoon, everyone. Today I am sharing my thoughts about the after effects of the pandemic as it hit us about 3 years earlier in March 2020. So that's why I've called this talk as my realizations from the last 3 years of pandemic and responses versus reactions. So, if we all remember, if we go back in time, on in somewhere in March 2023, suddenly we were told that we have to stop going out of our houses. We have to be confined in our homes for the next 21 days. This announcement was made by the Honorable Prime Minister on national TV, and suddenly people did not know what hit them. And as it happened, we were getting certain indications that there's some virus which was originated from China has hit everybody in the world, and it is spreading fast. There's no cure about it, and people were totally lost as to what exactly is this and what is it about. So when I we were told to go into kind of a quarantine for 21 days, it was a major problem for a lot of us because we were not prepared about it. Everybody was surprised, and nobody had any idea as to what is happening around them. Whether it was the government officials, whether it was the administration, and whether it was the people who were hit by it. And so, for me as an individual, I was still serving and I was in the army. So it was easier for us to implement all the instructions which were told to everybody to be implemented. We quarantined ourselves in our respective homes. We sent our mates for a holiday, told them not to go out, and we had adequately stocked ourselves so that we could manage our day-to-day requirements of daily requirements. However, many things happened simultaneously, especially for the youngsters who were used to working 24 hours, almost 24 hours in a day, and who were used to work for 5 days a week and party hard on the weekends, on Saturdays and Sundays. Everything stopped for them. They were confined to a single room in their house if they were fortunate enough. And in some cases, people were also forced to live the families, I would say, lived in a small one room or two room set. And it was very, very difficult for everybody to manage initially. However, one thing which stood us being in the armed forces was that we were used to stay in quarantine. So this kind of a quarantine was no quarantine, especially for us, because we were staying with our families. We had access to media, we had access to TV channels, we had access to the internet. Only thing what we could not do was we could not move out of our houses. Whereas I, for one, have stayed in an environment wherein I am confined to a small bunker with nobody around me except for the men who I was commanding. I could not speak to anybody. I did not access to have access to mobile phone or TV channels during those days because they were not existing. And only source of information available to people was the Doordarshan. Other than that, that also to very fortunate few who had these TVs at their home and who had the antennas installed in the houses. For us, only source of entertainment was a small transistor from which we could catch either the national channel or the Vivid Bharati, or at times we were lucky enough on Broadway we could catch Binaka Geet Mala on or BBC. So for me and many of us who are in the uniform, it was not that difficult to get adjusted to these things. But we did find that people had a really very tough time, and there were many issues which cropped up because of this. Because people were not used to staying at home, and they were not used to stay together as a family. So it became quite difficult for many of them. However, as things passed by, as the 21-day quarantine got over, and we thought that things are improving, and there was a little lull in the battle, as we call it in the army, and people were allowed to move out, but that too with prior permission from the police, prior permission from fixed timings, and also you had to tell them from where to where you are going. You could not travel intercity, you could not travel, all the public transport was shut down, and even if you have to travel in a private vehicle, you have to take permission from the government or the police department to move out from your houses. And that time, even there was no cure available. So only thing which was told to people was to have a paracetamol if you have fever or anything. Drink hot water, wear mask, sanitize your hands, wash your hands. And during those times, also many other things happened. Like we had this event wherein everybody was told to collect in the balconies and uh, make sound with their utensils to show their solidarity with the health workers who were fighting this unknown battle. And then there was a break. People started moving around, people started relaxing, and then we were hit by the second wave. And when the second wave hit us, it was much difficult for everybody. It was much more tough. The symptoms are very bad. Lots of families were affected adversely, and people lost their family members, their near and dear ones to this state. The hospitals and the government was unable to cater for the kind of casualties and the kind of patients which were coming to them. And it was mayhem everywhere. People were running around for beds in the hospital. People were running around to get oxygen cylinders. People were running around to get medicines, and all those things were happening. However, like it always happen, after every dark cloud there's a bright light, and after a dark night you have a bright sunshine. So that phase also got over. Then again there was a break. People again started moving around a little more. By that time the vaccine had also been developed, and we were told to have our first dose, but that too was available to limited people, especially to the senior citizens and those who were suffering with comorbidities. There was the first priority. Until the time we do not have the vaccine, you could not move around. There were still restrictions around. The travel was still restricted. You could not travel anywhere. You couldn't go anywhere out of your town. And that way the things carried on. And then came the third wave. And third wave, as we all know, is called the Omicron virus. This was another different variant. Again, a lot of people suffered with different symptoms. And by that time, most of the people who were in the elderly age group had been vaccinated by the first dose. And by the time the third wave finished, people had got used to living with restrictions and precautions, and you could see that whenever you are moving out, uh, people were wearing masks, people were using sanitizers and all kinds of precautions. And that is how things carried on. Then we got our second dose of vaccine, and then the vaccine was available to the youngsters also.